Another is called a feeling is not a fact. So if you're feeling sorrow, first you want to identify the emotion, right? Name it to tame it. I'm feeling sorrow. Sometimes we don't really know what we're feeling at first. So you have to, sometimes there's anger and then there's something underneath. So you actually want to identify the emotion or the emotions. And then you want to remind yourself that just because you're experiencing that emotion, it is not a fact. But the truth is, when your body is experiencing that emotion in that one moment, it feels like a fact. So you have to bring in your left brain and remind it, hey, I know this is your total body experience right now that you're feeling sorrow, but a feeling is not a fact, and I am more than just this feeling. So that's if you're having like an emotional day, you can bring in the left brain. If you're the type of person that tends to be more left-brained, where you like things to be very a certain way every day, and what you would have is a lot of stability in your life, but maybe not enough adaptability or flexibility. That would be more left-brained. What you want to do is you want to pay attention to the peripheral vision. This is interesting. So if you have someone who's a good friend of yours, and they tend to be very logical and linear, you could let them know about this brain exercise over dinner. You could bring it up. And what it is two things. You tell them to pay attention, what's on the periphery? Can you see what's on their peripheral vision? And then you ask them to tell you what emotion you're expressing on your face. And make a frown. Make a frown and ask them what emotion you're experiencing. Because a lot of times if people are really left-brained, they actually will not be able to identify the emotion that's on your face. Reading facial expressions and nonverbal communication is a right brain skill. So those are just little left and right brain tips, because I like to keep the information that I give you all practical. And then I'm going to talk about, that was horizontal. That was the left and right brain. So the vertical integration is interesting. The vertical integration is about your nervous system. And it really actually relates to how trauma is stored in your body. Vertical integration refers to the vertical toe-to-head nervous system flow and its healthy integration. So I talked about the prefrontal cortex up here. These are all the different functions of this part that thinks about thinking, this higher reasoning. It's called attuned communication. That requires the prefrontal cortex. That's where you're connecting with me, and I actually feel something when I look into your eyes. That's attuned communication. And believe it or not, that actually is a form of intimacy which causes physiological changes in my body and in your body when we make a connection. And I'm going to go into that part of the talk in a minute. But your heart actually begins to beat in rhythm with the more you begin to connect with someone. And then after your heart starts to beat in rhythm, this is really neat. Your respiration, your immune system, and your hormonal systems, they align. So two people that are not touching or anything, just making eye contact, maybe holding hands, over time, something happens to the body of both of them that is very beneficial. And it's amazing too. So that's one of the things I wanted to talk about. And I also want to encourage everyone here to do what they can to have more connection and intimacy, not only for your health, but for the health of people around you. So how do I know if my brain is integrated? So this is a little bit of a clinician kind of slide, but I'm going to go ahead and include it because I think it's interesting. When someone talks about a past event and they use the present tense, that is an indication of a lack of brain integration. And you'll see it most often when they're talking about a very traumatic event. So actually you can be a good friend by noticing something like this. If you have a friend and they're talking about something that was very emotionally charged for them, it could have been 60 years ago, but the charge, the emotional charge, still remains in the brain. If they begin to say, like here's an example, let's say I'm 30 years old, and then when I was 15, I was hit by my dad, and so I would be interviewed, and I would say, he hit me. That would be, I'm talking present tense, like I'm describing, yeah, 15 years ago, I went to the store, then he hit me, I went home, right? But hit is a present tense verb, but went home is a past tense verb. So it's a side thing, but you could pay attention to the verb tense. What is an indication of someone being integrated is when they're able to use a lot of descriptive words. So they're able to use a lot of different adjectives, a lot of different emotional words to describe the experience, and they use the correct verb tense. So that's a technical way. There's also lots of other things you can do looking at nonverbal communication. You know, the person's breathing can get more shallow. There's a whole physiological response that happens in the body when you're more stressed and you're remembering a stressful event. And this is the thing, the brain. Each time you think something, you change your brain. Each time you have a thought, you change your brain. So what you want to pay attention to is what are the thoughts that you think every day? It's the same thing with food when I give food and nutrition advice. What is the food that you eat every day? These are the things that you really want to look at and like more closely. So I'm going to go on to neuroplasticity, neurogenesis. The body, when you're having stuff go on like stress, really bad stress, all that good neuroplasticity, neurogenesis, brain integration, none of that happens at all. It shuts off. Because when you have a lot of stress, you know what's really happening? The adrenal glands, I don't know if you guys know where those are, it's part of the endocrine system. They sit right on top of the kidneys, which are back here. You got, some of you might have two, some might have one kidney. The adrenal glands, they pump out cortisol, which is a stress hormone. And when that cortisol surges through your body, this is when you're under stress, the limbic brain goes on fire, and your prefrontal cortex, it shuts down. So you really want to do your best to avoid stress. And everyone knows that we all have some stress in our life, and everyone has different levels of tolerance for stress too. But the key is, if you're noticing yourself becoming more stressed, you want to take charge and calm yourself down, because your physiological symptoms, your blood pressure, you suffer when you experience stress. You suffer. Your heart rate goes up. So you have to learn how to watch it and slow it down. So that's a little bit about stress. And I don't have good speakers on this phone, or I would do this brain game. So we'll just skip it. So these are, I'm going to give some tips, and then I'm going to give you guys a little, like a few minute break in case someone needs to go to the restroom, and then we'll have the second half hour. These are tips you can do to keep your brain healthy. You want to engage in new challenges. Okay, this means that you just want to do things differently. Because the brain, it likes to create patterns, and it likes to repeat those patterns. So a good metaphor is if you walk the same way to breakfast, you walk a different way. Whatever it is, you just do it a little bit differently. That's that you just try and change it up. So, and also, you want to do something that you normally wouldn't do. Whether it's talking with the person you normally wouldn't, whether it's doing an activity that you normally wouldn't, and you want to practice having an open mind, because that's going to help your brain. You don't even have to enjoy it. You don't, actually. You can just do it for the pure principle of trying something new and trying to get your brain to work. So, and you want to do whole brain thinking. So that would happen like with juggling. And being ambidextrous is an example of that. Playing musical instruments is an example of that. Does anyone have any things that they can think of that they might already be doing that's good for their brain health. Does anyone here play any musical instruments? Yeah? Yeah. Which, bridge? What do you play? Piano? Mm-hmm. Puzzles? Do you guys know the picture puzzles? Do you know that? Yeah, it's a free publication that they have. I know you can get it at Publix, but they have crosswords and puzzle games, and it comes out every month. It's called they're good. They're good. So what else? You want to practice focusing your attention. So you guys, you can check that off the list. You've been here, you're listening to me, you've done that, I'm making you sit here for a full hour. But that requires constant, focused concentration. And it's not the same thing as watching a TV, because the TV could be on and you could kind of check out, but I'm kind of talking and then following, so you got to pay extra attention. That is good for your brain. You're actually exercising your brain right now just by perking up your ears. And then I like this one, I found it, explore with childlike wonder. I like that better than keeping an open mind. I think that's kind of, but childlike wonder, and you want to remain curious. You know, the brain, especially the left brain, it likes to categorize and think that it knows everything. But the truth is that there's a lot of mystery in every day. And so if you can just explore like the way a baby might, they don't know what colors or smells or sights. They don't know what anything is. They just experience. So you can just try that as an activity one day. I'm going to just pretend like I'm seeing the world through new eyes. And again, that's like finding new challenges in your life. And then the other recommendation, which I'm sure you guys have heard over and over again, is exercise. And you know, there's a study that was done, if you exercise just walking for 30 minutes for 5 days out of the week, they found that was as effective as antidepressant medication for depression. So that's why some physicians will say, are you exercising? Before they'll prescribe an antidepressant. What I said in that statistic was that basically, according to studies, that it is just as likely that if you exercise for 30 minutes 5 times a week that your depression will improve as if you took an antidepressant that your depression will improve. They both have a 50% success rate. Learn to meditate. Does anyone here do any Tai Chi exercises? Oh yeah, we have a couple people. I love Tai Chi. It's an exercise where you move your arms and you're aware of your breath. It's a good way to focus your brain and calm down your heart rate. So I feel like Tai Chi is a form of meditation. And then here's the puzzle pages. I mentioned that already. And then this is just some other things. Develop stimulating friendships. Laugh often. Laughing is great medicine. Remember, when you're stressed out, those adrenal glands, they secrete all that cortisol. If you laugh, it secretes another hormone. It's called dopamine, which is like a feel-good chemical. So it's a way that you can counter the stress in your life by laughing. And then having plants, I actually mentioned that. I don't know if any of you guys are green thumbs or you like to garden. Plants are wonderful. They make the oxygen in the air pure, and they're really good for you. So because toxins are right up there with stress in terms of preventing the optimal functioning of your brain. So I'm going to get a little technical, but just for those who are listening, when you're around a bunch of petrochemicals, what happens is they get stuck to the hormone receptor sites, like the dopamine, the oxytocin, all those good hormones. The receptor sites get blocked by petrochemicals, so you don't have as many receptor sites, so you don't have the capacity to feel and experience as much dopamine joy as you normally would in life when you have a long life with petrochemicals and plastics and preservatives and other things that kind of block up the endocrine system. So plants, drinking plenty of water and getting clear, clean air, like the air that's purified by plants or going outside, really good for your brain health, really good for your brain health. And then I go a little bit into diet. I already said diet and exercise. Fat-soluble vitamins are really important. And I am going to give everyone a 5-minute break, and then we're going to talk about what happens in the body